Welcome to St. Jude in 5, a monthly podcast that covers topics from market trends to quality improvements and everything in between. My name is Heather Rieger. I am the Marketing and Communications Manager here at St. Jude Medical Center, and in each 5-minute episode, we'll offer interviews and stories that are useful, relevant, and maybe even a little inspiring. Today, we start with something worth celebrating. U.S. News and World Report just announced their 2019 Best Hospitals list, and St. Jude, once again, ranked among California's top hospitals. For the third year, we also earned a spot among the top 10% of the nation's hospitals in 10 areas of expertise, ranging from gastroenterology to neurosurgery. Two of the areas for which we were recognized, orthopedics and joint replacement, fall under the St. Jude Orthopedic Institute, a center of excellence that has already collected 5 national awards this year. We're pleased to have with us today Mick Grethy, physical therapist. Good morning. He's a physical therapist and service line manager of orthopedics, and he'll be talking with us today about how and why these honors just keep coming. So thank you so much for being here today, Mick.
Thank you, Heather. I'm happy to be interviewed by my favorite Rieger sister.
Thank you.
Don't tell your sister.
I won't. So 5 national awards. Wow, I mean, that is really impressive. And among those awards are one of America's Best Orthopedic Hospitals for Women's Choice Award, High Performing Center of Excellence by U.S. News and World Report, and one of just 62 hospitals in the nation to earn advanced certification in hip and knee replacement from the Joint Commission. So let's talk a little bit about that impressive list and tell us how you did that.
First and foremost, it's hard for me to not talk for orthopedics for just 5 minutes. I'm going to say that to begin with. However, that said, our orthopedic program at St. Jude, it starts with that orthopedic team. We have a group of orthopedic surgeons from our newest member who's specialty trained in sports medicine at Caroline and Job, Dr. Yin, right the way through our surgical group. And if you just look at their resumes, we have Yale and Harvard and Stanford and all listed in there, amongst other great medical schools, all the way up onto our most senior surgeon, Dr. Skinner, who's Professor Emeritus at UCI and taught at Harvard, internationally published. So that whole team together, if you put them with a dedicated nursing team on a dedicated orthopedic floor in the hospital with experts in rehab for both before and afterwards, it's fairly, when you put all of that together, it's fairly easy for us to reflect great patient outcomes and great patient satisfaction and patient experience. And it's important to say that, we fairly routinely now are in the top 25th in the nation for low knee infection rates. And similarly for our patient experience, we're routinely, I should say, in the 90th percentile for patient satisfaction. So much so that in 2016, 2017, we got the 5-star PRC report for in the hospital. And again, confident fingers crossed for 2018.
Now, of the list of awards that you've received, do you have a personal favorite?
It's really important to talk about the advanced certification in knee and hip replacements. Most of those awards tend to look at just the hospital experience in isolation, but the advanced certification takes scrutiny into how do you prepare the patient before their surgery in terms of education, setting expectations, optimization, and then give them an excellent experience within the hospital that provides seamless and efficient care, and then moves them on to moves them on early, gets them to home, puts them with home health early, puts them with outpatient therapy early, so that overall they have an accelerated experience in back to normal for them. And so the advanced certification looked at that whole process and sees how we've worked to take it seamlessly, not just into the hospital, but from beginning all the way to end for that experience. So we're very, very proud of that certification, and it puts us within 62 hospitals in the nation that have that award. So
now, you talked earlier about improvements in care. Do you have any specific examples that you could share?
It's fair to take a quick look back in how it used to be in joint replacements, and certainly when I first started doing therapy 26 years ago, not uncommon for a joint replacement patient to be in the hospital between 5 and 8 days, and it took us 2 people to get the patient on their feet. They may be in bed for a day or so because they felt so nauseous after their anesthesia. And now when you look at it, our patients can expect to be at least only one night in the hospital, going home early the next day to their home, not going to skilled nursing facilities, and having a home health therapist come visit them the following day. Again, that's the expectation now for our patients and the advanced care that we do at St. Jude's.
Now, the range of services offered at St. Jude is common to be seen at academic hospitals like UCLA or Cedars-Sinai, but it's uncommon at a community hospital. So what do you think is going to be the next edition of services offered at St. Jude?
Although we routinely talk about a patient staying for one night, and we already have patients who are coming into the hospital in the morning, having surgery, and then getting up on their feet within hours of the surgery, and then leaving it towards the end of the day to their home with their family and being treated the next morning by home health. And really the next wave of improvements in joint replacements is to do a true same-day surgery to the right patient. We think that we have the skills and ability to do that at St. Jude. We think that we're able to prepare our patients well enough to do that at St. Jude, and I think that we're going to see more and more of that. I'd also like to just mention advances in our hip fracture program. Again, when patients with severe hip fractures, they can be quite frail, and with our orthopedic hospitalists, we've been able to drive the care along with pharmacy and dedicated nursing to reduce the opioid complications with those patients, get them early to surgery, and move them on so that they have the greatest chance of restoration of normal function.
Now, one last question for you. Inquiring minds want to know, is Dr. Joseph Mayo III in any way affiliated with the Mayo Clinic?
He is. Indeed, he's the great-grandson of one of the Mayo brothers who founded the Mayo Clinic. He trained at the Mayo Medical School, and we're really happy to have him out here in Yorba Linda. I think another thing I'd like to mention as well, we keep talking about the hospital awards, and we talk about satisfaction scores, but it's really important for us to highlight the patient's experience in this. And we believe in orthopedics that we need to get our patient's voice to come back and tell us what their experience is like in the hospital. And so part of our program is also after 3 months after a patient's had their joint replacement, we ask them to come back and to tell us what their experience was like. And we use their voices to help drive some of the process improvements for the surgical committee. So patients are really central to us at St. Jude. It's part of our values, and we want to make sure that they're all part of the process as well.
Excellent. Well, thank you so much for being with us today, Mick. It's been my pleasure. And congratulations to the entire orthopedic team for a job well done. You have a lot to be proud of. So just a couple of public service announcements before we go. Remember that the AWS revote is scheduled for September 5th through September 16th, and a non-vote is equivalent to a no vote. So get out there and vote. And lastly, we do have open houses scheduled with our very own Brian Helleland, Chief Executive, at the end of September. So stay tuned for SJ Today with more of those specific dates. Thank you so much for joining us, and stay tuned for our next episode of St. Jude in 5.